Homocystinuria is a rare inherited disorder characterized by the body's inability to properly process the amino acid methionine due to a deficiency in cystathionine beta synthase, or CBS enzyme. This results in elevated levels of homocysteine and methionine in the blood and urine. Homocystinuria is an autosomal recessive disorder caused by mutations in the CBS gene. An individual must inherit the mutated CBS gene from both parents to be affected by the disorder. Without a functional CBS enzyme, homocysteine accumulates and is converted back into methionine, leading to elevated levels of homocysteine and methionine. Altered concentration of these amino acids can interfere with the stability of important proteins in the skin, connective tissues, and other tissues in the body. Symptoms of homocystinuria can vary widely, but often include neurological problems like developmental delays, intellectual disability, and psychiatric symptoms. Ophthalmic complications like dislocation of the lens or ectopia lentis, severe short-sightedness or myopia, pupillary block glaucoma and retinal detachment, skeletal abnormalities such as long limbs, tall stature, scoliosis, genu valgum or knocked knees and decreased bone density, premature atherosclerosis with increased risk of blood clots. Diagnosis of homocystinuria involves taking the patient's history and evaluating clinical features. If homocystinuria is suspected, a variety of specialized tests are conducted, including blood and urine tests for homocysteine, methionine, and cysteine, and genetic testing to identify mutations in the CBS gene. Some regions include homocystinuria in their newborn screening programs, which can detect the disorder early. Management of homocystinuria aims to reduce homocysteine levels and prevent complications. The primary treatment is vitamin B6 or pyridoxine, which enhances the activity of the CBS enzyme. In patients with no response to vitamin B6, betaine may be used. Betaine is a drug that can convert homocysteine to methionine via an alternative pathway, reducing homocysteine levels. Dietary modifications might be suggested to minimize methionine intake by limiting animal proteins such as bacon and eggs and increasing plant-based proteins like beans. Folic acid and vitamin B12 supplement can also help to reduce homocysteine levels in the blood. Genetic counseling is recommended to help families understand the genetics and natural history of homocystinuria and to provide psychosocial support. Homocystinuria is a complex metabolic disorder that requires lifelong management. With early diagnosis and appropriate treatment, individuals with homocystinuria can lead healthier lives, though monitoring and preventive care remain crucial to managing the condition's complications.